Welcome to Hotze Elite Physicians Podcast, where you'll learn how to help your patients obtain and maintain health and wellness naturally, and how you can have more time, more money, and more freedom to enjoy your life. And now your host, Dr. Hotze.
Hello, this is Dr. Steve Hotze, and welcome to Hotze Elite Physician Podcast. Today we have the opportunity to visit with Dr. Kimberley Schroeder. Dr. Schroeder was one of the first physicians that I helped train in our medical and business protocols from here at the Hotze Health and Wellness Center. As a matter of fact, she even worked for us for a period of time before she set up her own practice in the greater Houston area. She's in a city called Tomball, which is in the northwest part of Harris County, which is the county in which Houston is situated. So Dr. Schroeder came on board with us in 2005, and then she established her own clinic called the Institute for Health and Wellness. Now, Dr. Schroeder, welcome to our program today.
Dr. Hotze, thank you so much for inviting me to join you today. I'm excited.
Well, I'm excited to have you here, and I know our listeners, other physicians that are considering making a transition from an insurance-based practice, which leaves many physicians very pessimistic because they get burnt out because they have to see so many patients to make ends meet. They're on capitated fees. Any procedures they have are oftentimes discounted by the insurance company, and they get slow paid. So these guys and gals are having a hard time making ends meet. They got more administrative people on board trying to collect the insurance for which they're billing. And they also have all these regulatory problems with the government and with the insurance. And then the insurance company tells them how they have to treat their patients. They have to follow clinical practice guidelines established not by themselves and what they think is best for the patient, but what the insurance company does. So I know many of the physicians now listening to our podcast today, Dr. Schroeder, are interested in finding a way out. Now, tell us how it came about in 2005. Tell us about your background and what were you doing when we came to know each other, and how was it that you were interested in making a transition?
Absolutely. Well, I graduated residency in 1997 and started practice in Tomball and went in solo practice in 1998. And my vision of what practicing medicine was very quickly turned around because I really wanted to run a practice, have plenty of time with my patients, really educate them and teach them how to be as healthy as possible and really get to know them. As a family practitioner, I wanted to take care of the whole family. And so my vision was maybe seeing, 10 patients a day. We'd do house calls and things like that. And, that drastically changed within probably the first 2 weeks of practice. In a traditional practice, I remember for ourselves, we had to see between 30 and 35 patients a day, and that was in addition to hospital visits. So my day was at the hospital doing rounds very, very early on our ICU, CCU patients, and then back to clinic, and then back to hospital at lunchtime, and then, finishing up in clinic. And you might have had to actually go back to the hospital after if you had a later admit. So I worked weekends, evenings, holidays, as most of these doctors, as most of us all had to. And, I was writing prescriptions for every single issue that people were having, because when they came in, instead of being able to sit down and talk with them and teach them how to change their health issues, when you had to see that kind of volume, you had 5 to 7 minutes face-to-face time with your patient. And so there's no time. So we all fall into that habit of just writing prescriptions for everything, and it's one of those things. I woke up one day and thought, who am I helping? Am I helping anybody? In an acute care setting, if they have an acute problem, of course. But our patients with some chronic medical issues, if they came in with diabetes, did they ever not become diabetic again? And the answer is no. In addition to that, as a mom, I woke up one day and realized, I had no time with my family whatsoever. My oldest son is 21 years old, and I can tell you I probably wasn't around for any of his quote-unquote first. In fact, I remember one day he threw my phone in the garbage when he was about 2 because I was constantly on it. And so, I decided that I needed to make a change, and the problem was you just didn't know how. You got caught up in that model. And I'll tell you, Dr. Hotze, I was really praying about it. And you know how we get invited to pharmaceutical dinners and things like that. And I didn't have enough time for anything, so I never went. But one day my office manager brought in an invitation that you had sent to me to come and hear you speak and learn about your medical practices. And I thought, you know, I'm going to go do that. And I'll tell you, sir, what you said made sense. And, you know, you presented many of us with an opportunity of a lifetime to come and join you and be part of that team and learn how to incorporate health and wellness as naturally as possible. And I'll tell you, so the experience was amazing from start to finish. You know, your team provided us with amazing medical tools and protocols. But in addition, the business and marketing and hiring practices that we could incorporate immediately. And they walked us through the entire transition to the wellness practice. And here we are, you know, many, many years later and doing great.
Well, let me ask you, when you were on your own doing insurance-based medical practice, approximately how many patients were you having to see a day?
30 to 35 plus hospital.
Plus your hospital. And how many people did you have on your staff at that time?
We had approximately between 10 and 15.
And how many were doing insurance, insurance clerks for you?
We had 2, and then occasionally had to hire outside billing as well.
So, and were you pleased at that time? Did you have much additional time for family or free time or recreation?
Not at all. Not at all. You know, I can tell you I had been practicing for 6 or 7 years only at that time, and I was completely burnt out at that point. And I couldn't imagine how the rest of my life was going to have to be continuing in that model. And as you know, Dr. Hotze, you know, a lot of the times in family medicine, I was told that if we collected approximately 40% of what we billed out, we were doing doggone good. And that's hopefully if you collected it the first time around. If they denied it, then you're paying people to do your billing more than once on the same patient. And it was just a nightmare.
So you ended up coming. Where did we have the dinner that you attended? Do you remember?
I don't. I wish I could remember, but I can tell you, I just remember a lot of the things that you said that night. And you said that one time that, you know, this is an opportunity of a lifetime. And it was, I think I'm going to call it a God thing, because I was really praying, how can I figure out how to jump off of this ship?
And land in a lifeboat or get on.
Right. And then all of a sudden, you just laid everything in front of me, and I thought, wow. Wow.
I just got a note from Monica Ludicky, who is the president of our company. She's listening, and she said it was at River Oaks Country Club that we had that dinner. And I remember that dinner. And I can remember the people that attended that dinner. So how long did it take you to transition your practice from an insurance-based to a cash-based practice?
You know, not as long as I expected it to. You know, we started just slowing down on our traditional insurance patients when we started the Institute for Health and Wellness. And I would say about 3, maybe 4 months to really get transitioned to 100%.
Now that's amazing.
We were committed.
Well, this is, and for those doctors that are listening, I know one of the biggest concerns doctors have is, you know, I'm making my living right now off the insurance. They pay me. Now, they don't pay me well. They only pay me 40, 50, 60% of the most of what I'm billing. So I'm struggling to make ends meet. Were you finding yourself, when you were in insurance-based practice, were you struggling with your business model, being able to make ends meet?
Every payday, every end of the month, every rent payment, you know, and there were times that were good. I hate to even say this, but, you know, during flu season and bronchitis and such, you had a lot of hospital admits and such, but that's not what I wanted. I did not want that to be where my money was coming from. But yes, we struggled quite a bit.
So you literally transitioned in 3 to 4 months. I was expecting you to say 3 to 4 years. That's what I think the doctors listening were thinking you're going to say 3 to 4 years. But in 3 to 4 months, you had completely transitioned from insurance to a cash-based practice.
Yes.
So how did you announce to your patients? How did you announce to them that you were changing your business model?
Well, that's interesting because we tried, we did several different things because we really wanted to incorporate our patient base into the wellness practice. And so we explained to them that we were going to change our hours, and there might be just certain days that I was going to be available to do medical insurance type practice. But our focus, because we cared so much about their health care, our focus now was going to be health and wellness, and that we had an amazing opportunity to learn from you, Dr. Hotze, and you involved so many folks from your team to come in and make sure that transition worked well. And so a lot of our patients we were able to keep. They transitioned into the wellness care. It's obviously a lot we didn't, but the support that we had from your team, and honestly, sir, just being associated with the Hotze Health and Wellness Organization helped tremendously. I mean, that first year I was shocked at how many folks were driven to our practice.
And that's tremendous, and I really congratulate you on your success. That's wonderful. Now, what did you find about your financial situation? You got these patients over now. How did you decide to structure your fee schedule?
Well, at first, I kind of struggled with that, as I think a lot of people do. I mean, or a lot of doctors do when they only know that insurance model, even though it's terrible, it's all we know. And so at first it was kind of challenging actually charging patients a fee for their service or for our services. But it didn't last long for me to wrap my mind around it and the patients, because we were able to offer them time. I never had an hour face-to-face time with my patients in my traditional practice. So we offered just the time, the care, the hospitality that you teach us to do, because, again, we call our patients guests as well, and we know
That's
that
great.
It's their choice to come to see us. And they are just very grateful and gladly pay for your service, because someone's listening to them and someone really cares about the outcome as to whether or not they're going to pursue this journey of health and wellness.
So you started, when you made the transition, I presume you sent a letter to your current guests and told them, your current guests or patients, you told them what you were going to do. And then you sat back to wait to see who was going to come in.
Pretty much.
And there was not everyone. Obviously, you're going to lose some patients. They're not going to maybe see the value in having a physician that can practice the type of medicine that will enable them to get healthy and well naturally. They're kind of sold on the conventional medical model that the disease model, whether you give them drugs or surgery, and that's basically it. And you treat the symptom, you never get at the underlying cause, and you don't really prevent health problems. You wait. It's really, I like to say it like this. Doctors that practice conventional medicine have a sickness factory, and you and I and those that practice natural approaches to health and that have their patients pay cash for our services, we have a wellness factory. We keep people well. We keep them out of the hospital. We address the underlying cause of their symptoms rather than simply masking their symptoms with various pharmaceutical drugs, which you and I both know are toxins and poisons and create more problems rather than solve the underlying problem. So tell me, once you started into this, now 4 months you were transitioning to a cash-based practice. How long did it take you to feel really on top of it, that you had really good expertise and experience in using our medical protocols in the treatment of thyroid in hypothyroid patients and using clinical symptoms to make the diagnosis rather than relying strictly on blood tests, and the treatment of declining sex hormones and adrenal hormones, and the use of vitamins and minerals? How long did it take you till you felt really comfortable doing that?
I would have to honestly say about 2 to 3 months-ish. We went through pretty extensive training that you offered, Dr. Hotze, and even had to take an exam that was quite intensive.
Right.
So I felt right from the get-go that I had a good core understanding of how to do this. But again, it's a bit of a learning curve. And, there's, as an example, I remembered you talking to us about vitamin C. and the importance of it, and calling it a natural antihistamine. So I always knew that I could incorporate vitamin C or something else, but I may not have known the dosage, But the most valuable thing that I think helped us with this is your staff, your pharmacy, your vitamin store, anyone in leadership. That way we're always available if we needed something, and not only for us. If my patients or our guests had any issues at all, they just gave amazing customer service. And so I felt, even though I may not know what I know now, I still felt that I was confident enough that I had such a good foundation of how to do what you were teaching us to do, that it didn't stop me from getting started ASAP.
And let me ask you, how do your patients respond? What kind of results do you have with your patients?
Well, I can honestly say I remember just feeling so shocked when I would come in and see a new guest, and we get their protocol set up, and then they'd come back for follow-up, and I'd ask, how are you feeling? And they'd say, great. I thought, I've all that time in traditional medicine, I don't know that I ever got that response.
I never did.
And we have to tweak things. Obviously everyone's an individual, but for the most part, I would say the good majority of our patients were coming back and sharing with us that how much better they feel, and we were able to start the transition of getting folks off of a lot of their pharmaceutical meds, which I think that alone makes them feel better.
That's huge. Now, I like to say that those of us that do natural approaches to health, some people call it holistic, some people call it integrative, a lot of different names. It's just natural approaches to health. Those of us that do that all the doctors that I know practice that way have very successful medical practices. And let me ask you this. So your patients got good results and they were happy with you. For the first time, you were having patients come back saying, I love you, doctor. Thank you. You ever had, how many patients have you had tell you, thank you for giving me my life back?
I don't even know that I could count.
Yeah, I hear the same thing.
And it's not me. It's
right. It's
protocol and balancing what needs to be balanced.
And I haven't asked you this before. That question I did, but one thing I walk the halls here at the Hotze Health and Wellness Center, and while I don't primarily see our guests, we have other providers that do. Most of the patients that come here, because my name's on the building, when their friends ask them, who's your doctor? They go, well, Dr. Hotze's my doctor. Although I only maybe met them when they came in as a new guest and introduced myself. One of the other providers or physicians took care of them. But they say commonly when I see them, thank you for giving me my life back. Thank you for giving me my life back. You changed my life. I've had husbands say, thank you for giving me my wife back. So
exactly.
We've heard that, and you've heard that in your practice, right?
Oh, absolutely. Absolutely.
Now, this is what I say. We practice result-based medicine. Don't give me all this, well, we need show me your double-blind studies that this works. I tell you, the proof's in the pudding. And I have a business coach myself, and he tells me, he calls me General. He says, General, when problems are solved, money exchanges hands. People will pay you to solve their problems. Whether they have a broken air conditioner unit, you fix that. Whether they need a new car, you need new brakes, you need new clothes, you need legal services or medical services. People pay you when you solve their problems. And they tend to, the people that best solve their problems, they tend to compensate them handsomely. Now, how would you say your income has changed since you've adopted a cash-based practice and done natural approaches to health and help your patients get well naturally without the use of pharmaceutical drugs? Has your overall income increased at all?
It has, absolutely.
You think it's gone up by 10%, 20%, 50%, 100%? Has it doubled? Has it tripled? Well, how would you say your income's improved?
I would say at least doubled, sometimes almost tripled.
Okay, and approximately how many of your guests will you see per day?
I see 1 to 2 new guests in the morning, and then we do follow-ups in the afternoon, and that could range anywhere from 6 to 10. Certainly I could see more, but that's the other benefit of this type of a practice. I really wanted to do this so that I could live my life a little bit. And so the structure of our office hours are 9 to 4, Monday through Thursday. And my last patient is a phone visit usually at 4 o'clock. And I don't work holidays. I don't work weekends. I don't work evenings. I'm on call for myself, obviously, 24/7 because I am the solo provider. But I can tell you probably in an entire year's time, I've been called twice.
Did you hear that, doctors? Now, for you, those of you that are in primary care or primary internal medicine doctor or even OB-GYN, you've been on call during the weekend and just been covered up with phone calls. Now, what we offer here is a medical program, a medical protocol and business protocol that will allow you as a physician to have freedom where you don't get called. Now they're gonna think this is crazy, Dr. Schroeder. Like, why do they not get called? Why don't people call you, Dr. Kim? Why don't they call you on the weekends? Why don't they ever call? Why do you only get 2 calls a year?
Right. Well,
are they scared? Are they scared to call you?
No, we encourage it. I always tell them, if you're not happy with your treatment protocol, I'm just a phone call away. But because these protocols work so well for so many folks, and I will tell you, watching your staff and how they handle customer care and guest services, I'm very blessed with an amazing staff who cares. They get this. And so they go above and beyond to take care of patients' issues during the day as much as we can. Of course, if it's an emergency or something like that, we may have to refer out a little bit. But for the most part, I think our staff has been trained to mimic exactly your staff. And I think we really are able to cross our T's and dot our I's. And, most of the time, if somebody is calling after hours, it's very apologetic maybe to the nurse that, oh my gosh, they didn't get their prescription called in or something. But it's rarely ever that they're having a lot of major health issues at all. It's just, gosh, I'm getting on a plane in the morning and I forgot to get this called in kind of thing. That's
now, how does that compare when you're doing conventional medicine and the number of calls you would get on a weekend? Did you ever get calls on a weekend when you're doing conventional medical care?
Oh, absolutely. I was in a call group with about 8 to 10 doctors.
Oh my goodness.
And so when you were on call, you were on call. I mean, the weekends were horrible because you had to make rounds on all of their patients in the hospital. So you started at 4:35 in the morning and were lucky to get home by midnight, and you still weren't going to go to sleep. It was terrible.
Well, you no longer do a hospital practice, do you?
No, sir.
Okay, and we don't either. And it is so rare that any of our patients ever have to go to the hospital. It's just rare as hen's teeth. So
Right.
So I like to say that what we're practicing is result-based medicine. You cannot practice this type of medicine and generate the kind of enthusiasm among your patients, which we call guests too, among your guests, and have them pay you and compensate you handsomely if they're not doing well. I mean, the proof is in the pudding. So all these doctors that tell me, well, I need the double-blind study to know if this really works. I don't know. It's just, And then I've had doctors say, it's just the placebo effect that Dr. Hotze has on his patients, the placebo effect, just walking in the room, they feel better. Well, if I could do that, they ought to have me strutting through all the hospitals. I'll get them all feeling well.
Absolutely.
Anyway, so you're down the road 13, 14 years into having a practice that's based on natural approaches to health where you coach your patients on how to get healthy and well naturally, and your staff helps with that without the use of pharmaceutical drugs. Not to say that we never use them. We rarely use pharmaceutical drugs here at our practice. It's rare. We're always doing what you're doing. We're trying to get people off the pharmaceutical drugs, get them healthy and well naturally so they don't have to depend upon pharmaceutical drugs, which of course are toxins. And then they enjoy a better quality life. So there's no reason if people are, I don't care if they're 30, 40, 50, 60, 70, 80, they ought to be brimming with energy, going and blowing. They ought to have vim and vigor, and that's what we find in our patients at the Hotze Health and Wellness Center, what Dr. Schroeder finds in her patients at Institute of Health and Wellness. Now, for any of you physicians that would like to take a look at what Dr. Schroeder has done, simply following a very simple formula, simple medical protocols, simple business protocols, she has built independently her own very successful medical practice, which, doctors, is a business. We're not going to pull any punches. You may think, well, I'm a doctor. I don't need business protocols. Doctor, you're in a business and you need to run it like a business. And I know you're in a business because a business is any activity for which products or services are sold in exchange for money. And everybody out there that's a physician exchanges at least their services. You may have products you sell in exchange for money to your customers, who are your patients, and we call them guests. You're in business. And if you're in business, then you ought to operate your practice like a business. And you're not taught how to do that in med school. They didn't teach you to when you went to medical school, did they, Dr. Schroeder?
Not one bit.
Not one bit. So you've got to learn for somebody who's been successful in developing medical and business protocols that work. And if you adopt that, then you're going to find you have more time, you have more money, and more freedom to enjoy your life. Would you agree with that, Dr. Schroeder?
Absolutely.
Well, I thank you for your story. It's a great story, and I congratulate you on your success. I don't take any credit for it. My staff and I were business coaches to you. And I believe that if you're going to be successful in transitioning in a practice, you ought to follow a model by someone who's already done it successfully. If you want to be successful, just do what successful people do. So that's why at Hotze Elite Physicians, we provide you with that. I want every one of the physicians with whom we work to have more time, more money, and more freedom to enjoy their life because they've helped their patients get on a path of health and wellness naturally. And the credit goes to you, Dr. Schroeder, because we shared our protocols with you, both medical and business. You didn't have to adopt them. You could have gone about and said, I'm not going to do that. I'm going to stay. But you chose to do a 180, and it made a huge difference in the lives of literally tens of thousands of people because everybody you help get well is in a family, an average of 4 people. So if you improve the quality of their family life, and most of these people are employed, so you improve the lives of the people with whom they work and the businesses, and you improve their lives. And in doing that, you improve your staff's life, and you improved your life and your family's life. So it was a win-win for everybody.
I agree.
Well, thank you for joining us today, Dr. Kimberley Schroeder. And where can they go to look at your website?
They can go to feelwellagain.com.
Feelwellagain.com. That's great. Well, again, and that's so you can take a look at Kimberley's practicing, and you can go to Hotze Elite Physicians, which is HotzeElite.com, HotzeElite.com, and you can peruse our website and see what we have to offer you to help you get your medical practice on a path of health and wellness. Thank you so much, Dr. Schroeder, and thank each one of you for joining us here. I do believe that every doctor needs to have a successful doctor to coach them onto a path of successful business practices so they have more time, more money, and more freedom to enjoy their lives. And that's what Hotze Elite Physicians has been established to do. Thanks for joining us today. God bless each and every one of you.
If you're ready to do a 180 and take charge of your practice and your life, make sure to visit HotzeElite.com for all the tools and resources you need to transition into a cash-based practice. More time, more money, and more freedom to enjoy your life is waiting for you at HotzeElite.com.
This podcast is solely for educational purposes and does not constitute medical advice.